When Boris Johnson told the country we need to learn to live with COVID, he promised that those at highest risk would be protected. That includes people with health conditions like cancer, diabetes, heart disease, and those with weakened immune systems. That promise was not kept. Clinically vulnerable families have been raising the alarm for 6 years. Today, Baroness Hallett has published her findings and recognises the significant need for effective antiviral treatments. The inquiry accepts without reservation that we need to provide protection to the immunocompromised, including through preventative drugs, and that this must be a priority. Baroness Hallett has held that the government should pay close attention to the needs of clinically vulnerable and access to vaccines in a safe environment. We're pleased that the inquiry has recognised the significant difficulties in accessing antivirals, which remain today. The report recognises that vaccines have saved millions of lives. There was an extraordinary national effort. Over 250,000 people still died and continue to die from COVID, and the vast majority were clinically vulnerable, and many of those deaths were avoidable. Millions of people with serious health conditions who continue to receive flu vaccines and have been quietly removed from the COVID vaccine protection programme, but their risk has not gone because of the cost. It is against the guidance of the World Health Organization, against the evidence. We must remember that the virus didn't disappear, the support did, leaving clinically vulnerable people increasingly exposed. Families are still forced to travel abroad to protect their children, driving to Germany, flying to America, because UK children's vaccine rollout was far too slow, too limited and too short. Even today, clinically vulnerable children are denied vaccines. One doctor in Germany vaccinating a clinically vulnerable child from the UK asked, "Why can't she get this at home?" And for those who can't rely on vaccines for protection, there was another option, a preventative treatment, Eversheld, approved for use in the UK, but used in France, Germany, the US, every other comparable Western country. But we didn't buy it or use it. Shamefully, the UK were the only Western country that didn't. It's clear from the findings that preventative treatments were sacrificed at the expense of the vaccine programme. This was not a failure, it was a choice. 4 years, 4 Prime Ministers, and the people at highest risk are still waiting for protection. Where's Streeting? You promised an end to sticking past politics. You promised a health service that will keep people well, not that just treats them when they become sick. We are asking to meet you. The tools exist, evidence is clear. Living with COVID should not mean living without protection.
I'm Shannon Banks, and I'm one of the community that's represented by clinically vulnerable families. I'm clinically vulnerable and was invited to get the COVID vaccine in February of 2021, early, as a priority. Unfortunately, the vaccine triggered my lupus and caused heart damage. I was in and out of hospital for 9 months, and I ended up on lifetime heart medication. Understandably, my doctors advised me to no longer get any more COVID vaccines. But when I asked what I should do instead, nothing was made available. Despite the fact that a treatment was approved in the UK, it was not purchased by the UK, and it was not allowed for us to have. As a result, I lived apart from my family for over a year, shielding alone in a flat. I lost a year of my daughter's life as she went through school as a teenager. I lost friends, and I lost work, and I lost time. We are still at risk today, and we need support, and we need an alternative. So not only for the next pandemic do we need an alternative to the vaccines and a multi-tiered approach, we need support now.
So I'm another member of Clinically Vulnerable Families, and the quote that was there about why couldn't this child get her vaccine at home was actually my daughter, who at the time, at 4 years old and being clinically vulnerable herself and immune suppressed, couldn't access a vaccine within the UK, and I had to take her to Germany. Utterly incredible in this day and age. And I'm sorry to say that really vaccines are no better now. Indeed, the government continually reduces the eligibility list for COVID vaccines. such that even today many people with cancer, heart disease, diabetes, asthma can no longer access COVID vaccines. This is a serious problem, as we know. The NHS is severely under stress at the moment, and particularly during winter, and we just ask the government to seriously reconsider both vaccine offers to vulnerable children and also increasing the eligibility list for adults. Thank you.
Hello, my name's Sarah Stephen. I'm also a member of Clinically Vulnerable Families. My family member currently has cancer. When he caught COVID recently, we knew that there was an antiviral available on the NHS, and we were really happy that that could help him. But we also knew that that antiviral needed to be taken within 5 days. We did a COVID test at home, he was positive. We did another one, he was positive. So we took him straight away to hospital as we were advised on his cancer red card. When we got him there, the hospital did not administer antivirals straight away. They said they needed to test him again for COVID with their own test. It needed to be sent off to the lab, and it took days to get the result back. By the time the result eventually came back, that 5-day window for taking the drugs had practically closed. I think it's really important that this report identifies that the system for getting antivirals to the people that need them is broken. It needs to be fixed now, because 5 days is an incredibly short window, and there is no time to waste when dealing with somebody's life or death. I'm really happy that CVF understands that COVID is still a serious issue for people with serious health conditions, and that includes cancer patients, those with heart disease, diabetes, etc. The list goes on. Most of the people dying are clinically vulnerable, and we're here just to make sure that those people stay alive. Thank you.